Hi, my name's Marissa McDonald. I'm the physiotherapist currently working at Balham Park Surgery. We provide a physiotherapy service 2 days a week here on a Tuesday and Thursday. So this podcast is going to just be a short snippet explaining to you what is physiotherapy, what physiotherapists do, and what to expect on your first session. So, what is physiotherapy? Physiotherapy is a healthcare profession that aims to improve movement, function and quality of life through a holistic approach using physical treatments. The Chartered Society of Physiotherapy, which is our governing body, explains physiotherapy as a physical approach to promoting, maintaining and restoring mental, physical and social well-being, taking into account individuals' variability. It's a science-based approach which is underpinned by current evidence and research. So what do physiotherapists do? We work with people of a variety of ages, with a vast array of conditions in a variety of settings, including orthopaedics, paediatrics, women's health, neurology, respiratory and musculoskeletal services, just to name a few. At Balham Park Surgery we provide a musculoskeletal service which aims to treat those with impairments and injuries of their muscular, skeletal or soft tissue systems. We use a variety of treatment techniques to help you with your problem, including manipulation, mobilisation, acupuncture, massage, therapeutic exercise, hydrotherapy and also electrotherapy. The treatment we use to treat your specific problem will depend on what your therapist determines the most appropriate and evidence-based treatment for that condition, and also what best suits your needs. Common conditions that we treat include osteoarthritis of the knee, hip, back and other joints of the body, neck and back pain. We treat post-surgical patients and those who have just recently had fractures. We look at things like tennis elbow and other common sporting conditions, and we look at muscular aches, pains, sprains and tears, and also any work-related disorders such as repetitive strain injury. So now we're going to talk about what to expect on your first physiotherapy appointment. The appointment will last about 45 minutes, and during this time we'll take a detailed assessment of your impairment or injury. During this time we'll ask you about the nature of your symptoms, the history behind them, their pattern and what makes things worse or better. We'll then talk to you about your past medical history and your medication history, because this gives us an idea of what else may be influencing your condition. We then go on to look at your social history and your lifestyle. This is because physiotherapy takes into account individuals' psychological, physical and social circumstances, and also lifestyle factors that we know can have an influence on dysfunction. The second part of your assessment will be much more of a physical examination, during which time you may be required to expose the area involved and the adjacent areas. What we'll do is we'll look at how you stand, so your posture, we'll look at your movement, and at times we may also place our hands on you to test certain structures. From that assessment and along with the goals that you set with your physiotherapist, we'll then develop a treatment plan, and this will likely include some exercises for you to complete at home that's going to aim to mobilise, stretch and strengthen the tissues involved. Physiotherapy shouldn't cause pain, but for some it can initially cause some discomfort as we start to move structures that haven't been moved for a while. Lastly, a big part of physiotherapy is health promotion and education. Physiotherapists can advise you on how to manage your condition, which is especially useful for those with chronic conditions. So this is physiotherapy in a nutshell. If you feel like physiotherapy may be of benefit to you or you have more questions, then speak to your GP.